MMT, shoulder extension, latissimus dorsi. Assist the patient to the short sitting position with feet dangling to prevent lower extremity substitution. The patient should position the hands flat on the table next to the hips. Stand at the test side in a position to guard against a fall or to prevent a substitution. There is no passive assessment for this portion of the test. In patient-appropriate language, ask the patient to lift the buttocks off the table. If necessary, you may stabilize the legs to hold them steady, being careful not to assist by holding up the legs to decrease their weight. Common substitutions include excessive trunk movement while elevated and having the feet on the floor to assist with the weight of the trunk. The patient may not flex the elbows to use the triceps. Please note that it's not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may start the test immediately. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient as necessary. The resistance is provided by the weight of the body. Grade 5, normal. The patient is able to lift the buttocks clear of the table for a 5-second count. If the patient is unable to meet this condition, the patient must be repositioned and the test begins again from a grade 5. Grade 5 through 0. Position the patient prone with the head turned toward the test side. The arms are at the sides with the shoulder in internal rotation. Stand at the test side and support the forearm above the patient's wrist with both hands. Have the patient elevate the shoulder to the chin. Ask the patient to move the shoulder caudally, then apply resistance into shoulder elevation. Grade 5, normal. The patient completes full range of motion in shoulder depression and holds against maximum resistance. Grade 4, good. The patient completes full range of motion in shoulder depression and holds against moderate to strong resistance. Grade 3, fair. The patient completes full range of motion in shoulder depression but does not tolerate any resistance. Grade 2, poor. The patient completes partial range of motion in shoulder depression. For Grade 1, stand at the test side close to the patient's arm. Palpate the latissimus dorsi by placing your fingers over the lateral aspect of the thoracic wall. The patient attempts to depress the shoulder. Grade 1, trace. Palpable contractile activity with no motion. Grade 0, no palpable contraction.